in our instance, contracted care and getting this program to work. Next to me, Mr. Phil Mokodi, who worked at our head office, responsible for business development, but more importantly, his key role is our collaboration with the state sector. And he facilitates our collaboration and our partnerships with the state sector. And we thank Mr. Mokodi for being here. The Deputy Director General, the Chief of Hospital Services, Tertiary Services in the province is Dr. Mangopane, also a gynecologist by profession and training. We welcome Dr. Mangopane and really thank him for the support. And we work very closely with Clinix Group in terms of collaboration. We are a willing collaborator, and the state is also a willing collaborator. We have a fundamental belief that we can jointly create success for the health sector in the country, and Dr. Mangopane is a strong believer.
Can I go feel better? So it's about the platform. Where does a person go when the potential? When they go, you don't have to go into major depression because we can feel it. Yesterday we were dealing with a patient who has got who is admitted for other things, but the BP was not going down. The physician says, I've given everything. Then we go to a psychologist. There we discover that the person is a gambler. She's losing everything. She has started losing the car. You know, the sheriff is chasing the car. She might be losing the house. But one thing, because she's middle class like all of us, in that hospital that she always had a computer. So you think they're doing assignments and everything. But remember now you can gamble or lie. So only yesterday we started understanding why are we not winning in terms of treating her. She was pregnant. She's got the threat that she might not be able to raise the child. But as an educated person like that, she lacked the platform. All along. She's only discovered now that this person actually has been in severe depression because the baby isn't going down. So, without narrating a lot because of time, the bottom line is for us here and other colleagues to create the platform where people can easily express themselves. We discussed in one of the gatherings here, Dr. Speko, in the past year, that we need to emphasize primary health care mental intervention. Because as a country, we don't have enough facilities now to accommodate everyone. And who needs to accommodate it? They are advanced. Let's catch them when it's still coming at the primary health care level. Let's, as we discussed, let's collaborate with other fields, churches. We have learned that in terms of the level of listening, the churches are more listening than us in the medical side.
Yes.
So that is a strategy. So if you want your message to really, go through the church leaders, traditional leaders, influencers. Those people get more listening than ourselves. You will realize some of the consultations when you say this, they say, but so and so said so and so. Then we say, what does so and so do? Find that it's a traditional, the church, companion of leadership. So there are also good opportunities to convey the message. Because we have to deal with this as actively as we dealt with COVID and all the other conditions at that time. Otherwise, we won't be. It's covered by the fact that life is not getting easy. It's getting more and more difficult, financially and otherwise. So we have to have a strategy to fight difficult life. You need to strong market. What you are getting as a vice versa is people who are currently or in the past were stronger than us. I mean, that generation was very strong. Going on the bench. At that time, they saw the start, but it's actually more tougher now. and the people are weaker. So that's why we get a lot of suicides, a lot of broken relations, siblings fighting, divorces. It's like go towards closing, even if you are doing consultation for another thing, you find that you spend more time than dealing with mental health, and you'll easily find them complaining about the workload that they have to do mental health wise than the broken bone. Because out of that consultation, a lot comes. Then you deal with that and get back. So there's a lot of interventions that we need to discuss, but we need to pick up the 5 best and say, this we are going to implement. We'll discuss in another round to say, what are we doing by the so-called high risk areas? And Dr. Smeko, since we had that discussion, you can check the data. We're talking about SAPS. That's one example of the area where there's a lot of mental health issues. We might have done work on it, but if you are to count to say how many police staff kill themselves since our discussion until now, your figure will be more than 50. So it means we made the right decision. We have made the right decision. We need to do the work on it. From my side, the latest one that I saw is last week, where an officer killed himself, partner, and other factors, all those things. So it's no longer theoretical, it's no longer about writing chapters. We just have to implement the issue of creating the platform where both level of community, youth, adults, middle class, don't take them for granted, they're very stressed, can express themselves and not find it very difficult. We have to make an appointment and go through the shaming and all those things. So the ball is on our hands to champion that. Some of these things, Dr. Slogo, as you retire, I think we might have to say, just do community work. Because I also know that we're not very strong on community psychiatry. That's where you take the problem still fresh at primary level. Then we will get less complications. Jefferson, there's a lot to kind of write around this. Yeah. But in terms of the collaboration, I just want to have the platform. I need to thank you. I basically think that we need each other. So it's not only you guys because you're in corporate space. We also need. I found myself for the past 2 days having to answer and talk about life is domain suddenly. And when that happens, then I mention a lot of you. Mention a lot of yourself, because one of the answers is to say we have patients that are better housed, decently housed here, and also then that is supported by the fact that the contract that we were renewing on monthly basis now it's a formal contract to go through signing. I'm saying it because now it's an order secrets behind the scene work. So we continue working together and we appreciate. And let's always aim to do more. There are still patients that are not accommodated under mental health. There are categories, there's still categories where we're still feeling uncomfortable in the manner that we're treating them. Those that spend 48 hours in the casualty area in hospitals were uncomfortable, but those will become the discussions of other days. And in a nutshell, I'm saying we need to keep on strategizing together and all the other stakeholders that exist, so that at one point we should be able to say we're in control. In the language of Brazil in soccer, if you are on a draw, you're not doing well. 1-1, 2-2, you're not doing well. 1 is not comfortable. Start needing 4-0, then you say, we are winning. So you need to go to the back. Say, it's 4-0, even if they do well, they can go away. But it's not this 4 week, 4 of this week and next week is 1 million agreement. You cannot buy a house in this game. We have to consistently have the upper hand. Then we won't see people working on the street with mental. I think I'll be there.
Thank you so much. Thank you. Thank you so much. I think the stories Dr. Mangopane narrates are no longer distant. They are here in our homes, in our families, in our communities. And I think the take-out message for us here as employees and employers is number one, self-care. Number two, can we seek help? Number three, can we create the dialogue platforms? Just a place to talk. You're coming onto shift in the morning and you're not having a good day, or it's been a bad week. You know, last week we had one mortality, we had a fall incident. Those things all impact us as persons. We should sit down as a team and debrief ourselves from that. But more importantly, let's take care of ourselves. We are all that we have. You know, I like, Doc, your comment about boundaries. Boundaries is not only about the workplace. I'm learning a very difficult task, Dr. Sibeko, and I can't say because I'm aging, but I guess that I'm not sure if it's wisdom. But we also have to set boundaries to our families, to our communities. We also have to switch off from them at times. We can't just be the first number that they phone. We also have to find a no within us to say, sorry, I can't. Okay, I can't, this one I can't do. Okay, I think we are so, especially us as males, Rafil, we are the saviors of our families, Dr. Makupane. But then, what if we drop dead tomorrow? Or we literally have to go into assisted or involuntary care? Do we think we are of any value to them? So it's important that we self-care. Dr. Sibeko, Radisha, Dr. Mangopane introduced the issue of collaboration. The contract has been awarded to us. We are ever thankful to the department. I'm going to go off brief a little bit. In this room are the people who's going to implement this contract. And I want to pick up on Dr. Mangopane's point around creating that platform, creating those services. Our role is to reintegrate people back into the community. Dr. Sibeko, Radisha, you are at the forefront. You've been for years. This is an opportunity to talk to the people who's going to implement the contract. We're already looking after assisted care patients. And maybe Dr. Sibeko, with the gift of wisdom, share from your heart, what is our role? What would, you know, a contract has a whole lot of legal terms in it, but it doesn't articulate what the patient's day, the patient's week, the patient's month looks like. Can you share with us some of those practical points? Thank you.
Thank you, Mr. Bennett. Thank you for putting us on the spotlight. Never informed that all part of this panel discussion. We thought it was going to be our MEC was going to be participating in this roundtable thing. Okay, we've had a relationship with the Clinix Health Group since 2017. That is when they were roped in to assist the department following the life-stream tragedy, and with open and warm open arms, they accepted to provide the services, which are not easy. Looking after chronic mental health care users is not an easy task. So we've had quite a number of years to have this relationship, which has proven to be a very good one with Clinix and the other counterparts. You are looking after our chronic mental care users who are in need of further management and care. They've been in our facilities for a number of years. The SLA would say they should have been treated within our own facilities, public sector facilities, for at least a period of 2 years. And then they are given to you with all the complications. You know, when you get them at the end of their journey as users, they are complicated, they have complications, they have side complications and also physical complications. And we're so grateful for the fact that you have been able to provide these services and exceptionally well. I cannot say compared to what we picked up is that you were not providing them in the past, you just were not in at that time, but then you managed to provide the services pretty well. It takes very strong people. People are passionate to look after our users. And I strongly think Clinix has that group of people who are very passionate with their mental health. As I am, I'm exiting very soon, but I will still carry on. Because I know as Dr. Mokubane said, mental health has become a pandemic at the present moment. So there are so many people that are in need of our services. Literature has it that 1 in 6 has a mental disorder, but probably, as I'm speaking to you, it's 1 in 3. From what we hear through media, families are being wiped up by gunmen who, some of them come from jail, they're on parole and they decide to wipe out families. It's mental illness. It all has to do with mental illness. And there's a very thin line between mental health and mental illness. So we've had this relationship, Mr. Bennett, with you, and we are hoping it will become stronger and stronger as the years go by. You have been awarded another 3 years to carry on with the work, to carry on providing the services for the chronic mental care users. And I sure think you'll do the best as you have done before. We've never been treated like executives in a facility like we are with the Clinix Health Group. And even our own patients are treated the same. Because when you look at their diet that they get on a daily basis, it's hotel kind of menus that they are provided with. Just to highlight one thing which I observed as being one of the key things that we look into home access facilities. Are they well looked after? Are they getting all the basic necessities that they should be getting? And Clinix has been found to be doing that exceptionally well. Well, there are gaps here and there which you need to close, which we've highlighted when we conducted an assessment today. I think it was this very month or last month. Last month. Yeah, but so far so good. And if you carry on doing providing the best care that you're currently providing, you'll even get more patients to look after. At present, you are standing at 424. And we have another bulk, about 400 beds that we need to be allocating. So that is what we'll be looking into. So yeah, that's about it. I sure think Reds would like to add. She thinks she has a brain similar to mine. She thinks the same way as I. She will have more.
Is it osmosis?
Yeah. More wisdom to it.
She's got a mind there. Thank you, Ratisha. Thank you, Dr. Sibeko.
Good morning, and thank you for giving us this opportunity. Dr. Sibeko tells everybody we share the same brain. So maybe just to add, I think we've been so happy each time we come through for an assessment. Maybe just going back to the Mental Health Care Act, it talks about care, treatment, and rehabilitation. And the aim of the Department of Health and all of us is to keep our users out of hospital. And I think we have been so good with providing rehabilitation. Maybe just to announce that we will be having a workshop called Introduction to Psychosocial Rehabilitation, ward-based. And we will be extending an invite. We will be giving you and our other provider a number that can attend this workshop. Because if we do not do ward-based rehabilitation programs, there's no way we're going to discharge patients. Whilst we emphasize discharge, we know there's a line of patients also waiting for admission. So we do need to see turnover But obviously, we're not churning out patients. We need to do solid work with them and keep them out there. I think we also look forward to collaboration, stronger collaboration between yourselves and the hospitals that are supposed to support you. We know most of our site patients are having complex medical conditions, and that is something we need to look at how we take forward. Maybe just touching briefly on mental health in the workplace. The social work in me comes out now. You know, I think when we look, if I can bring it a little bit closer to home, when you think about yourself and what got you to work today, you're trying to wake up, maybe you didn't have electricity, the water wasn't okay, the children were not all right, transport, traffic. By the time you come here, you're already late. You've already lived half the day in your head, and you've got commitments here. And if every day is going to be like this, what is it doing to your mental health? So by the time we get to work, we need to just take that breath, to talk to each other. You know, debriefing in the workplace does not have to be from an extensive external provider. It's to talk to each other. Because if we don't, or if we are not, when we are not being able to meet our needs from talking to each other, then we need professional intervention. And we need to seek that at any clinic should be able to, I'm not saying they do provide, should be able to provide you with that service. And whilst we say integration of mental health, you know, you don't have to say you want to see. So the minute you say psychologist or psychiatrist, that stigma is there. There's registered counselors, there's the nurse, there's the social worker. Please make that effort to talk to some professional. Because we cannot trust everybody around us. Everybody cannot be our friends. You don't want to be the office gossip as well. So find a professional where you're in a comfortable space and we can talk to that professional. Dr. Sibeko and I always, you know, in the office, they look at us and say, oh, you are mental health. Because we often make that time, we discuss everything. It's so important to be able to laugh at yourself. And that's what we do often, Dr. Sibeko. We laugh. You'll hear we are a very loud company of people. So there's nothing wrong about laughing and laughing at yourself. So day to day, take that small, you know, look out for the small things. It doesn't have to be something major, but look out for the small things that build up, that will eventually affect you. Try and just catch it before it does. Thank you.
Thank you so much. Thank you. Mr. Mormoli, as we close, it's the last question. So you spend a lot of time in boardrooms, meeting with stakeholders, meeting with government. I'm going to continue in this vein. So we don't see that. We don't see those discussions. You help us draft contracts. But when you are sitting there, what do you expect from us who implement these contracts, who keep these relationships going? And I'll capture that in the spirit of Clinix Health Group and the ethos that our CEO drives. Number one is we are a community player. Number two is we service our people. And I'll underline our people. And we service them where they are in the communities. And we are committed to assist government create access to affordable quality healthcare. So that's the marching orders that Rafael has been given. Now, Rafael, here we sit, you've assisted us to facilitate another contract with the Department of Health. It's been a collective task. But here we are, yes, mental health in the workplace. We've got to look after ourselves. But what should we be delivering? Just before I got here, as we were walking into this function, Mr. Mokhoni shared with me that he says, you guys are starting to host VIPs here in this facility as well. Okay. Now that's a lot of the work that's being done on the outside. I've just got a message now from the group CEO, which was sent to you by a family to say, our family member is coming there. Please, can your team keep an eye out on the patient. I want us to be practical and leave some take-home notes. Take-home note number one is, can we take care of ourselves? I like the way you put it. Can we please take responsibility to find care for ourselves? So that's take-home number one. But now we've got a contract, we're celebrating the contract. Many people are happy here because Dr. Mangopane, they've also been on month-to-month contracts. So when I get a month-to-month contract, they go on a month-to-month contract. So HR is now busy finalizing 3-year contracts, which I'm sure is good news and assists with the mental health as well. But we have some responsibilities, Mr. Fokoli. You sell a picture out there to stakeholders. What do you want us to focus on here as employees on the site here?
No, I must thank the CEO, Matike, and the ESCO team and the board of Clinix. And remember our facility are in the, you'll never find us in the Santin area. Our facilities are in the townships, and that's where we more care. And also that because the government, which is what our new government, look at how they operate. If you meet with the premier, you know, the first thing that I captured is that if you want to move software and understand how operate, I think Dr. knows that. The first meeting, I didn't operate the premier. I went to the MEC and I was happy that she brought the team, and I was surprised that there were a lot of doctors, and I'm sitting there and I tell the boss to say, this meeting, boss, it's a great meeting for us. And in that meeting, we sell the company and sell, and also all our facilities. And we also spoke about your facility. Then we went to the next level. Then I look at it, and then I brought the premier. Then premier alone, so that it must not have this. In that meeting with the premier, and the premier was safe. I'm sure, and I said, don't worry. Then we said we as Clinix, we want to clear the air between the public and the private sector and work hard to make sure that we close the gap. Because if you the patient move from let's say Bara to SK, the patient must understand that it's not about the difference, it's about the care. And that's what we will. So from our employees, for me, is to efficiency and be competent and make sure that you respect the patient, you listen, you work hard, you protect your brand, because if you drop the ball, then they start talking outside. It becomes a problem. Because it becomes a problem for us, some of us, to go and sit in the meetings. I can tell you it's not easy to sit with Dr. Mangopane in a meeting. It's here, I can tell you something, or we can get up. He has so much. He will tell you, I've got, I don't know how many hospitals in Gauteng. He will tell you, I'm near the hospital, the public clinics, but you were 1 hour away from it. I think 15 minutes is enough for you. And these are the things that we work. The NEC, I mean, the social development, NEC, the balance of, she doesn't get that. She can't say she'll make this room small. So these are the people that then we also assure them that our staff, our leadership put the things right. So to speak about the food, to also talk, remember we spoke about the food. We said the food also talks a lot. Our security talks a lot. Everything from the gate, the receiving, our cleaners, when they receive people, they must not be seen the different, And those are the things that when you go to this meeting, you relax, then you focus on the proper, on the positive side, and you sell the facility properly. And I must thank you also again for making sure that you know that when you come here, me and you always said, can we paint the facility, change the facility, change the chairs, change this thing, even the one that are not, they don't need chairs, just change them for the sake of moving forward. And here today we're sitting with I can tell you, Dr. Smith was going to tell you, why must I come to you? Please come to me to my office. Now they're the one that want to come to our facilities, and we're happy to be. And I say, bravo. Yeah. Why not? I even said last time, get a black Uber, you refuse. I say, go and fetch them. them a nice car, a Mercedes, they fetch them, and let them come here and take them back. If they want to go home, take them back home. Just take over the mountain or what? Because above them, there are politicians who doesn't understand some of the strategies. They implement what they think and they sell the story to politicians.
Thank you so much, Professor. I think you've been practical. Dr. Mangopane, I'm going to ask you to close and wrap up the two themes. Theme number one is the workplace, but also we've got to provide care. You started with that challenge. Actually, we're providing care right now. We're going to leave here. So caring for ourselves, I think that's a new priority for all of us, including myself. That's just a new, must-needed priority. But we've got patients in the wards right now that we need to rehabilitate back into the community. And Dr. Sibeko, Dr. Mangopane, and Radisha has pressure of patients in the system now that needs to get into the facility. So Dr. Mangopane, your closing comments, thank you.
Chan, thank you very much. That when I raised my hand, I wanted to express separate point which in the first and come to review. So as colleagues discuss about the finalization of the contract for the 3 years, those months of renewal, monthly renewals, they were very big and they were very much uncomfortable. That's on our side, but also on the side of the management level. But the one group of people is the people who are working with you on that contract on month-to-month basis. So if they are here in this gathering, I want to confuse them. Because at that phase, we were solving mental health problems, creating other mental health. I remember around the festive season of last year, I was in the airport. We were having this conversation with one of the executive from Vegas. And his point was, I don't know what to say to them as to whether they still have the job or not. And therefore they are professionals in their own right, and they cannot plan. And if we're not getting the contract, they cannot acquire jobs in such short space of time. We try to find a line. I think, I'm not sure if I spoke to you, but one person that I spoke to was the CFO. Those were the times when we advertising, re-advertising, finding this course. Colleagues, if you may just understand, as I apologize, the government processes, they are very frustrating. They won't only frustrate you, they also frustrate us internally because it's processes that you cannot jump. If you find a sentence missing, the whole thing can go from re-advertising back to re-advertising. You put one extra word in the contract or in the proposal that is wrong, the whole thing goes back from scratch. So if that was happening, so for those who are really affected or who were on the month-to-month contract, obviously at any point on the 25th, 30th, you were not well mental because you didn't know from what I was briefed, we didn't know whether we are extending or not. So it is on this day that we are very sure and certain that we can say we apologize. We try to do it in time. We try to do adverts in time and so forth. Like I'm saying, there were problems from both parties, from our side, also from the document part on your side and so forth. But in a nutshell, one is just saying, so it's not like we're being insensitive, not too worried about yourself, who are actually the fun people to give care to this. So let's close that chapter, move on smoothly with the new signed arrangement. Let's be active. When we deal with mental health, let's not only focus on the inpatients, on fund mental health, even if you mix the person in the mall. One issue that amongst issue from the years of practice that really satisfies me is the job. I was one day in the festive season in the Westgate Mall in front of Edgar's. There was a lady, youngish in look, but she looked uncomfortable. Then I stopped and asked, "What's wrong?" She had a hip fracture. She was on the list waiting for 4 months for hip replacement. We changed numbers. It was a Saturday. Monday, I spoke to one of the officers, and he indicated to me, no, actually it's the right time because my first day is has collapsed because one of the patients was supposed to go to theater. It's not controlled from the diabetic point of view, so they won't be fixed with it. So out of that, that lady jumped from 4 months to 3 days, got a hip replacement. She became young again because it was not by age, it was just other circumstances. So, but then I'm not saying in diabetes, I didn't make a jump again. That is that way. And she didn't stop calling me. She came to my office, she found me sitting in the office. She danced and looked at the other side, demonstrating how different life is for her. Yes. Let's practice that. I know some of us practice that. If Rafael, I'm driving you in Deep Blue Square and I park there, you'll see those boys in the parking boys. They all rush to my car. Out of just maybe frequenting there and interacting, I ended up knowing that well, they're all on their own. Out of that group, I ended up knowing who is due for rehab, who is on the meeting, who is going, whether they're going Lane or West End and so forth. So even now, unfortunately, they relapse. But you see, I was not formally at work. It was just that I passed them most of the time. And I managed to capture this. And out of them, some are clean. We don't get 100% in terms of the addiction. Some of them, they keep on going back and so forth. So what I'm trying to say is, if us here and other colleagues somewhere, we confront mental health, I'm touching the point now of the community, we confront mental health from all angles, there might be some improvement. If you have to say, in my street, I'm going to deal with those is easier in the township. In my street, I'm going to deal with all that things like mental. And we adopt that strategy, all of us. It will take some, so it will improve the situation. Remember, you don't have to treat them, but you will assist them in presenting, you will be encouraging them to present. And these people, they give you feedback. They do give you feedback. They give feedback. The issue of mental health in the workplace, that's a problem. If I can explain and off record. When I sit in the executive meeting, we were all sitting there and I look around the table. I think at some point we are all not well. So, then I always have this joke because more or less on average where is my age group. And then there are also then the upper age group there. I always joke to say, is everyone here on aspirin? Because the pressure is so hard. You see, when we break differently because of monitors. We won't see tears, we won't see crying, but we break down in our own way. I gave you the example of a colleague who had this outcome. You just say that at any time, any one of us can. Because now you start connecting the effects of mental health and the vital organs like the heart, the stomach, and so forth. So we need to really start being positive, even if the issues are challenging, even if we have to be robust. let's create the professional environment so that you can detach the work from the person. You cannot afford to have enemies in the same corridor at the workplace. You're not helping. You're not helping the situation. We have got enemies here in the corridor of your work. You're not in good terms with one of your child at home. So where do you live? Mentally, you don't have a home. Here you will just then concentrate on doing what you do. Sometimes you even do it bad because you're not in the good space. When you arrive home, you don't want to meet that child in the corridor of the house. You go and lock yourself in the room. You go to your bed, you don't fall asleep. You roll and roll and roll. 2 hours, wake up and come back here on a daily basis. So you see how easy it is to lose quality of life on a day-to-day basis. There's other factors that can come to also. So colleagues, let's try from all cylinders to protect our mental feeling and those that we get in touch with. Work, at home, in the community. If you are in a gathering, funeral or wedding, if one child comes running and wants to talk, if you can't, reassure them that you listen to them at a later stage if you can show that. Because when they do that, they are burying. You might find that they are just on the edge. Lose that opportunity, you feel bad after. But the issues don't come out well for those. It's an emotional issue with this matter. And I feel that one can go on and on, but I think my plea is action behind the situation. Let's have action. Let's operationalize these issues and these strategies. When I rush here from another meeting that is the WHO meeting, it deals with supporting the people with disabilities, kids, and all those things, so that they at least have all the devices. But what is the underlying tone there? It's mental health. We're saying to them, look, we are sitting with this situation. We want your mental health so that these devices that we provide can make sense. Because they have to think positively. I think again, let's pack it there. And but let's have renewed energy from this point to say we are going to fire from all cylinders to attack mental health. Otherwise, it will get out of control. It's actually out of control. Well, yes, thank you for your good audience. I don't know, Chairperson, if you would have wanted an item where we can take a few questions from the floor so that we don't assume that we're in the right direction. We also need advice from the things that are on the ground. Sorry to add that part, but I just think it's important. Thanks.
Thank you, Chairperson. Dr. Sibeko's got a comment. I just want to pick up on one comment that Dr. Mankopane makes, and that's our role in the communities as individuals. But also, we don't lose our professions when we're in the shopping mall and at the family meetings and at the funeral. What sets us apart here itself is that we also set ourselves out to be a beacon of hope. That is why we have Dr. Sipeko, Dr. Makwani. We have what's called a walk-in program. So I like the example about the car guards. Our message is very simple. Rafael knows. He calls me and says, Fabian, so-and-so has called me. We've got a standard response. Bring them here. And then bring them here is not about admitting them. We are a group of professionals who live in the community. We can take a few minutes out of our day, talk to a family. Yesterday, we had a father in a child with a history of substance abuse and long-standing intellectual disability. The father doesn't know what to do. He called and I said, please come. It took 3 or 15 minutes for the father to talk to him. That's our free time. Okay? We talk to the father, we guide them in the right direction. So it would be very sad, Dr. Mangopane, if we have family members and in our families, and substance abuse is a very topical one as an example, battling with substance abuse, but we can't bring them to our gate. We bring them here, we take them to Fox Street to see social development, we get approval for admission, we admit them. We bring them here, we refer them to the primary health care clinic, or not refer them, We walk with them to the primary healthcare clinic. And I don't want us to lose that point. Myself and Dr. Mo and others, we're working on policies and all of those things. But the problem is here today. You get into an Uber and you can see my Uber driver is not okay. Invite him back tomorrow. He come. I've got a social worker, I've got an occupational therapist, I've got a nurse, I've got a psychiatrist, I've got a doctor, I've got a dietitian, I've got a willing person to listen, I've got a counselor who can just help you map out your problem. And I think that's practical and real. If we have queues at the gate, we'll deal with that on another day. We'll call Dr. Mangopane and say, Dr. Mangopane, how can you help us with this? But we have a responsibility out there because this thing, the area we work in is not like in Dr. Mangopane, in somebody's that works in obstetrics. It comes and goes from a family, okay? And you know, you get pregnant and you become less pregnant. Okay? But mental health, it stays with all of us. It's real in our lives. Just ask a colleague, can you speak to my son, please? Can I bring him tomorrow? I'm not sure if I'm making sense, colleagues. Can you speak? Mom Mercy, I've got a back pain that's not going away. Mom Mercy, please, have you got 10 minutes for me? Are we advocating that she must give you free physiotherapy? No, you must use your medical aid. But what stops you from saying, Mom Mercy, I've got this back pain, the doctors say I don't have any back problem. Can you look at me, please? And I think if we can inculcate that with each other, take a colleague by the hand and says, let's go and speak to social workers quickly. Let's just unpack this discussion. And I think if we can take that challenge, Dr. Sebeko's got a challenge with us in terms of employee wellness.
I was just asking Mr. Bennett if you have that program, employee health and wellness program in Clinix Health. And the next question is, are your health professionals utilizing that program? Because in the public sector, they don't seem to be keen on utilizing. We're supposed to be addressing your issues, but now we're telling you to address other people's issues. Yeah. So do you utilize the degree of the program?
Yes. You can come in. We're just having a discussion.
Good question. They don't see.
You can have a seat. So MEC, a very warm welcome to you. And we're having a very interesting discussion, MEC. And I'm going to put you on the spot, MEC, as we welcome you. The discussion we're having is about mental health in the workplace, because that's the theme. And when we were reflecting and preparing for this discussion, we said, no, sometimes we always look at it from the perspective of us as employers. But we are also employees, and in your instance, a deployee. So by virtue of you being a deployee, you've just been through your own personal crisis over the last few weeks. And here you are, having 20 appointments in the same hour, being called by your boss, by your principal, by your stakeholders, fighting fires. And we were just reflecting on, so what do we do as employees or deployees? Because we are all in a workplace. Phil just focused on the fact that most of his time he spends in sports fraternity. And the sportsman on the sports field is also in the workplace, facing challenges of mental health. So a warm welcome to you, MEC. But on that note, let's start there. Mental health in the workplace as a deployee. We are employees, you are a deployee.
I thought I'm crashing my company is here. I did apologize because Premier called us. But when I looked at the time, I said that my next appointment is at 1. Let me take it 10. That's next door to my house at the Clinix, yeah, which is Murewa, one of the important names that you have even used for this center. But basically, you are right. Well, I always say to people, we think that we're fine living better, and we're not fine living all of us. Doesn't mean that because you don't see me doing other funny things, I'm okay. And then what do we need to do? What we need to do is those regular checkups that we should encourage ourselves to do them. Because once you start opening up to somebody, even if it's because that person doesn't know you, and that person will be able to understand that now she is not okay, or she's fine. One of those examples about me, just the incident that happened that I was fine. And I realized that I lost my mother on the 16th, and we were preparing for an event, which was a political event on Thursdays, which always have those events on Thursday. And I was fighting everyone because they removed my name that I must not speak on Thursday. And for me, the fight was that why do you think that I can't do it? Because that's what my mother would want me to do. But I forget that culturally, I am not supposed to be seen interacting directly with people at that particular time that I'm at that stage of mind. Because my mind is not fine. But for me, I felt that my mind is fine. So those are the basic things that we should start even be guiding ourselves if we are at the workplace. Just start from there. Are you still at the right of state of mind? Interact amongst us. And if we see that there's something that is not that is it's all part that you are doing. You are not aware that, but mentally you are mentally disturbed, but you want to pretend as if you are fine because you are leading by the way. And sometimes then you will come across your employees, they are going through serious challenges at work. Sometimes some of them they're divorcing. When you're in that state of mind, you are not on the right state of mind. Automatically there's something not right in you. And you're going to take that pressure or the anger to other people that are next to you. Then that's why I'm saying screaming, checking ourselves, encouraging us that we are all the same, but we have different things that we are going through at a specific time. We need to work together as a collective and as a team. And I think I was talking to one young chap at the Makopan when I was telling him that I'm coming here. And I was saying even when I told him that I'm blushing here, I said to him, I'm blushing there because I think what they are doing there at Six Molewa Clinics, the clinics group at Six Molewa, it's something that we should do even to other hospitals in Makopan. Because here there's this healing that they are specializing on the activities that a person should see himself as doing. Because if you're in hospital, you can't just sit and not do anything. Because that thing, it clouds you. Your mind is not working properly. You're waiting for sister to wake up, check your vitals and other things, but there is no other activity that you are doing. But by the activities that you are making these kids and elders that are here, was not only young people, you are healing them psychologically. That part that you're doing, it's one of the best for me that it will even help us reduce even part of the monies that you are using for medication. Because the activity like singing, which you were doing one time, exercising, which I was doing, that 5 minutes that you're amongst other people and you're jumping and you're doing all those activities, it's part of healing. Going to the gardening, you see that beautiful gardening that you are doing, they're doing themselves. It brings pride. Even if the community thought I'm no longer an important person, this is what I'm able to do. These are the achievements that out of all the journey that I've gone through, now I'm doing something. I'm washing a car, somebody's car. The tires are shining. So those are the things that we must do, Dr. Pega. We must do now. We must introduce them. Our partnership and our collaboration with yourselves must be now on how do you assist us in this part that there's been lull on our sides. We've not been doing it, we've not been seeing it that was pumping medication and other things, but there are no other activities that people are doing. It's not going to help us. So that's why I'm here, and that's why I felt that you need to be supported. People like myself who are political leaders who go to communities and see these children going through pain, who must be seen talking to yourselves by taking you to those areas. And I know last week was supposed to be in Kalinin together. Pity then I went to cancel our appointment. but we'll still call you that was, I want you to take rounds with me now to other hospitals. Besides that, you will open doors for those that must be held here. But how do we deal with those ones that are there so that we ease up the pressure from the hospitals? When they go, well, yeah, you take people for 2 months, 3 months, they are fine, you release them. But again, how government should assist you then when Dr. Makopane Dev release these children so that they don't come back again here. So that's another plan now, Pekane, that we must work on it. How do we assist them at born and how do they assist us in the hospitals so that this cycle doesn't just become a vicious cycle. It's a cycle that we take them back to communities and with the skills that they are able to be employed and be able to work. And even what they're doing of saying to some of them, come back and volunteer. Because they still want to be here, and when they volunteer, they're able to talk about their own experience with I was where you are, and I'm no longer there. And how do we bring that from company to us, have those that are better, which will be helped by them with our collaboration and partnership, to say to those that are getting there, it's nothing what you are doing, you are going to. I've been more than what you are in terms of my state of mind. But now I'm better. But thank you so much for allowing me and your wish over to make sense to you. Good thing is that I'm making examples like me that soon I was not making sense recently and I'm trying to recover. Coming to it's part of my healing, by the way. I want to recover and I can't recover if I'm not coming and talk to yourselves about my state of mind and what I'm doing now to try and be normal and be a normal.
Thank you so much. Thank you so much. I think you touch a very important point, and that is that we do go through phases in our lives where we must just take some time out, reflect, regroup. I think the challenge we have, Dr. Sibeko, the other doctors around the table, is that as we come out of those times, we rush back. And I know the MEC won't mind, but on Monday morning, we were both at this London airport running back to this world, to this life. You know, both, we were in between.
And you reminded.
And I was saying to the MEC, I hope you've got no meetings for the day. But I was also coming from bereavement, and I had meetings waiting aligned for me. You know, and already, where are we? We are on Wednesday today. It's just been 3 days back in the real world. You know, so we need to keep that balance, Dr. Magopan, as you said to us. MEC, just lastly, another ambush. We are so grateful that after a very rigorous, detailed, I think a 2-year tender process. Is it 2 years, Dr. Sibeko? We submitted and resubmitted and resubmitted. We had workshops about tenders, which documents 3 years tender process. You know, we're very comfortable that we've been through a rigorous process. But here in the room are the majority of the people, firstly, MEC, who showed their commitment to the program. Some of them were on month-to-month contracts. HR is now busy converting those to 3-year contracts. But I think it would be a miss of us, MEC. Contracts have legal words in them. But you are the custodian of healthcare in the province. When we work, when we talk, when we engage, we are implementing your portfolio, your responsibility. Your department has given us and trusted us with taking care of 426 of your patients. For the Department of Health, we look after other programs as well, like 155 substance abuse patients. From your heart, MEC, what would you want us to see? What would you want to see when you engage with this facility, when you hear about this facility, when you visit this facility? What do you want to see from us as the implementers on, as we call it, on the shop floor, speaking, engaging, providing care? Thank you. Thank you, Ms.
What I want to see from yourselves is for you, which partly I've already noticed that you're doing, of serving them with a smile, with dignity, bringing them the dignity that they deserve. And then the compassion that you always give it to for each and every patient that is here. I've seen it because I've visited the center and I've seen that work that you did, which was out of this world for me. That's why I said, I remember the already on the very same day, I said to them, I want you to copy that model. It's a simple model that they're doing. they make everyone feel at home. So I want you to continue with the work that you've been doing. Just when I was getting in here, the person that welcomed me, I felt good. I felt at home. He was going somewhere, but he turned back immediately when he saw me. He said, "MC, good morning. This is the area where we are." I said, "Where are you sitting, guys, today?" He said, "Just here." And I followed him. It's a simple thing that doesn't even need any amount of money, but that acceptance, when I get in, I felt that this is the home. So, and I know the day I was here, I observed that you were not faking it, what you were doing, every corner where you have taken me to, and how you have been treating them, how you have been communicating with them. It means a lot because you made everyone knows that you know them, you appreciate their role, you understand exactly what they are going through. They're still human beings. So I really appreciate that, and that's why I'm saying our partners with yourselves will be more than just about transaction. Our relationship must not be more of transaction. It must be our relationship of building this province, this country, changing the lives of those who have been helpless. Because you do interviews to all these people that comes. You know that they go through a lot. Some they don't want to be here, but because of the circumstances and the environment where they come from, they end up here. But then you bring that hope. So that's what I want from you to continue doing that angle of bringing hope to those that are hopeless.
Thank you so much. Thank you. Executive, can you very briefly close for us? And then Dr. Mokopane, on behalf of the department, will close for us.
So I think in closing, I just want to thank and acknowledge our employees and the people on the ground and our ethos of the Clinix way of treating everyone, our bedside manner, compassion, acknowledging the patients that we have, and treating everybody with, as the MEC said, with the smile and the dignity that they deserve, and ensuring that we take care of our patients and we are there for our patients. If there's one thing about this facility, and we always say that this is their home, and they need to feel as if that this is their home. And the hard work that our employees have put into ensuring that this is there. From our side, as Fabian has said, and as we have all said, that we're here to give access to healthcare. And we ensure that we're giving access to healthcare to some of the most vulnerable people within our society. And as Clinix, we appreciate and we will continue to be part of this partnership with government and ensure that we deliver to the expectations of government and even exceed that, because that is what we always say is the Clinix way. Thank you.
In closing, anything, thanks for the words of wisdom. We found us having discussed this and that, so the engines were already heated, but you came in fresh and hit the nail in terms of what needs to happen, what should make the difference. Also acknowledging that there's a lot of work that being done in a good way. Really, the feeling is we can always do more. The plan is still confronting us. The battle hasn't been won. The battle needs multifaceted approach. We need to confront mental health at all levels. At workplace, as we sit here as professionals, at social level, as we fully agreed, whenever you see the color of mental health, confront. From our side, as department, obviously, we this day will be thanking you a lot to help us in this collaboration. You can imagine if we didn't have a place for 426 patients, what would be happening? What else would be happening? So we need more in terms of activities, in terms of accommodation, and in terms of the aggressive approach to mental health. We know because we worked in these situations together We also converge at social level. We also know that you're confronting substance abuse, which overlaps between access departments, social development, as well as health. That work needs to be emphasized, to be expanded, because we still have our mental health people on the streets. So we need to work more, we need to work harder until we feel we are defeated. We have seen that feeling does prevail. If we feel that we have defeated COVID, then we can defeat any condition that confronts us. So I would then be saying, let's go back to the commitments, let's work harder than we're doing, and we will see the results in the subsequent meetings as we meet here. We'll be able to see even the difference of the work that we're performing. Colleagues, my fellow colleagues from both sides, I want to thank you very much for your time and your daily efforts in terms of doing this. Thank you very much.
Thank you so much. The challenge us earlier. I'm going to give an opportunity to two of our staff members just to make comments, but we haven't closed. But it would be very useful just to hear the reflections. There's a staff member on that side, and there's one staff member on this end. Just reflections from colleagues.
Hey everyone, thank you for the opportunity. I have a few comments to make. First of all, with regards to what the gynecologist has said about actually. His names, sorry.
Are you planning something?
About actually the plans that have been made. When you made reference to what is happening in the SAPS, right? And what the chief medical officer also said about feeling guilty about taking leave. The DOD has this system where every DOD member is forced to take at least 5 to 10 days a year consistently. So if we can also have something like that, where we are forced to say take 5 days to go and rest sometimes once a year, that could help a lot. And then also with regards to what Dr. Sibek was saying about the employee health and wellness program. We do have, but the challenge that I feel we have is the physical access of it. As it was mentioned that you wake up already and your mental health is just kicking in, traffic and everything, you are here, you leave at 5 or at 6, you get home, it's late at night. There isn't really an opportunity for you to actually access the employee health and wellness program. But if we can have the physical service here for us to access here, then at least during my lunch hour, I can take 10 minutes, 15 or 20, and walk into that office and have a debriefing session with that service. With regards to accessing the services amongst us as colleagues, it's the barriers to that is the psychological safety of it. If I'm going to talk to Erasmus, who's my colleague as a social worker, about what I'm going through, then I'm not going to feel psychologically safe that Erasmus can refer patients to me in terms of he believes I'm competent, because now he has insight into, okay, he's going through 1, 2, 3, so I'm going to refer that patient to him. So that's also the challenge in terms of why are we not utilizing each other in terms of accessing the services, because we're colleagues. But I think if we can have the physical access, the physical services for employee health and wellness here, that can go a long way in terms of us accessing mental health care services. Yeah, that's all.
Thank you very much. Thank you.
Okay, good afternoon, everyone. My name is Rasmus Marshall. I'm a social worker, and I'm also responsible for all the admission in POH psych ward. So I just want to comment on the flow of admission and discharge, because it also affects us as social worker, part of the process of discharge and admissions, and also a challenge to us as social workers, whereby families doesn't want to take the patient home, and we find it hard to reunite the patient with the family, because the families doesn't want to take, doesn't want to make consent to take the patient home. So my comment is that should I request from the department that at least we collaborate, or they give us an access to some of the NGOs whereby we can also refer this, because we've got a challenge of discharging and admitting, and then that flow has been blocked because we can't discharge the patients and we can't admit the patients. And then the tertiary or the government hospitals, they are full. And then the access from the community for patients that are in the community, for people in the communities, they need this access, but the flow has been blocked. If there is no longer a flow, so should we find a way of us collaborating with the NGOs whereby we can place these patients and help us to engage families whereby they would understand the importance of us going. Yeah, that's my comment. Thank you.
Thank you so much. Thank you. Thank you. I think those are valid points. I'm just going to ask for a response, Dr. Sibeko, just on the one issue, revolving door, but more importantly, the stigma issue we spoke about earlier this morning, where families are saying, it's your problem. This is the state's problem. And I think as practitioners, they're articulating the real challenge. I picked up the opportunity of employee wellness, and I'll comment there first, Dr. Sibeko. So you are quite right. It's about creating access. And one of the things that we are exploring, I think the social work team has first-hand experience of that. We are piloting the use of, so Clinix is unique in many ways. One of the ways we are unique, MEC, is that we also employ chaplains. But chaplains who are not particularly aligned to one or forcing one religion or set of beliefs. Chaplains who are able to take an holistic approach. So we have onboarded we're piloting the service of a chaplain here to allow opportunities for staff to debrief. And sometimes a psychologist speaking to a psychologist is not useful, but a psychologist speaking to a person who can listen and be confidential and so on is useful. So we're piloting that. And the other thing in the workplace, I want to pick up on Radisha's point, is the challenge I always give the teams here is, can we create laughter in the workplace? So nothing stops us from having socks day tomorrow or pink dress day the next day.
Yeah.
Can we reflect on our stories? Can we get onto the sports fields? Can we dance with the patients? We've got lots of team building activities. We've got swimming pools on site. I'm not sure if we can swim. So yes, there's the psychosocial intervention, but I think Rafael also assisted us to say that mental health is not only about intervention by professionals, and Dr. Monkapani said not only with medication, it's also activities. And I think I would challenge teams and the managers, let's create that explosion here as well. That not only do our staff dance and sing, I wonder if you have your own garden here. I hope you're not planting weed or anything, but there's so much space on this facility that I can have my plant system missing. And I can also grow my plant. I can also harvest my cabbages at the facility. So I do think I leave that challenge to us as a team to create that environment. The facilities are here. I wonder if you don't know how to sew, if you've been to the sewing machines or you've been to the art rooms, you've escorted your patients, but you join the table and you also draw a picture. Because some of our problem, Dr. Marwesi, is that we live in our professions. And then we try and get home and we try and switch off. What the environment creates is that we can just be ourselves. We can swim, we can play soccer, we can sing, we can dance, we can do sewing. And it's that balance of us being stuck on the report at 10 o'clock. I've got a submission for DSD, which is due at 4 o'clock today. So I'm rushing there. But why could I not, after this meeting, go take a walk to the garden, laugh with the patients for 15 minutes, and then put all my energy in the Department of Social Development submission. So I would leave the employee wellness there. Dr. Sibeko, revolving door, families don't want their patients there.
That's a tough one. However, I'm glad that the Honorable MEC is here, because that is a an issue that should be thrown back to our communities. We need to start educating them. In the past, we used to say, most of the side hospitals would say, oh, bring them back to us, they are our people. No, they are not our people. They still belong to their families. However, our communities have this notion that once they get admitted into psychiatric facilities, then they belong to the state. We are at present trying to create that awareness with our communities to say, you need to give them an opportunity to be reintegrated back into communities when we are following their admission into our facilities. So we are pushing, even the Mental Health Care Act is talking deinstitutionalization of patients. So we need to support it by us increasing the number of non-governmental organizations that are out there in case some families cannot cope with them. Because in some instances, it's not that they don't want to have them back, but they don't know, they have no way of coping with them. They have no knowledge of coping with them. So it's important for us to involve the families when you rehabilitate these patients. They should form part of that rehab program. So that when the time comes for the patients to be discharged back home, they are understood by their family members. Yeah. So basically that's it. But you have we have about 144 NGOs within our communities. We have a list of those NGOs. I hope we have shared it with the facilities, even contracted care. So it is there, it's available. Yeah, and we are not prohibiting you from interacting with those NGOs. Actually, we need social workers to go and have a look of where they are sending their patients to post-discharge. So you have to collaborate with those NGOs. You are allowed to do that.
Thank you, Dr. Sibeko. Colleagues, we can continue on this discussion for the entire day. I'm really happy. It's also been therapy for me. I'm sure you can feel the same. Just reprioritizing again. Two things. Number one is ourselves as carers. The system needs us beyond retirement. The system, and then also reprioritizing our focus, and then I'll wrap up our focus. I must pick up on the MEC's point. It's deinstitutionalization and making people live a normal life here. They must buy here, they must smoke here, they must dance here, they must wash cars here, they must do sewing here. Families must come and join them here in our facility. We must not be irritated at families who want to visit. They must visit at any time. They must come, they must go with their family member to the arts home. They must go work in the garden with them. They must know the medication. We must issue the medication to them. So those are all the activities. And I think the closing parting shots, which all the colleagues have mentioned on, is can we look after ourselves so that we can maximize our compassion? We maximize our compassion for each other's colleagues, but more importantly, compassion for our jobs. And then lastly, colleagues, my appeal to you as your leader is a lot of hard work. I think many of you don't realize, you now understand some of the hard work that goes into changing from a month-to-month contract and now having a 3-year contract. Can we be responsible? Jobs are scarce. There's unemployment in the country. Professionals are unemployed. Can we be responsible? Can we engage? Can we support each other? Can we upskill ourselves? But I think I shared with you that one of the commitments we made a few years ago, obviously, was the issue of job preservation. So do all these things. I like your comments. Staff didn't understand why they, as a professional graduate occupational therapist, I must now go and work in a garden. Okay, staff couldn't understand that it's therapy, but now the staff are bought into that because this is about job preservation. And I will close with that. Let's look after ourselves. Let's push our compassion, but more importantly, let's be responsible with our professions. These are our people. Ethics is important. Dignity. And colleagues, I wish you well with the 3-year contract. I thank the department. But also then I wish us well with this reality that faces all of us with mental health. It's real. Let's look it in the eye, like Dr. Mankopane says. And once again, Honorable MEC, our sincere thanks to you for making the time. It displays to us and to the staff your commitment, your passion to turning our health system around. And more importantly, our local facility level, that very important to the work that you do. So can we stand and give our our panelists and the Honorable MC a round of applause as a token of appreciation. Thank you. Thank you very much, colleagues. You'll see yourselves trend on the social media. You should put the hashtag selfie. I'm going to ask that our visitors join us for a light snack, and then the rest of us will follow it. Please take photos with the MEC and the honorable members, so that you can also tell people you know people. Thank you very much, everybody. Thank you. Thank you. Thank you. Can we take over? Yes, commencing everything. Thank you so much.
Yes.